go ahead and unpause the recording so we'll have what we need to share out after our meeting. Thank you, Dr. Tudor. Wonderful, wonderful. Happy Friday, everyone. We'll get started in another minute. If you're just joining us, please enter your name and your organization's name in the chat. Lynn, thankfully you're on. You're going to be presenting in a few minutes, so it's good to see your name come across the chat. Happy Friday. We're still getting a small flow of joiners, but I think we're okay to go ahead and get started. Ryan, if you want to advance that one more slide today, we've got a packed agenda, but we're going to spend a good chunk of our time talking about justice involved, and we'll have Lynn Carr, a guest speaker, and an active participant, obviously, in our CPI, is going to spend some time talking about justice involved. Now, it's come up in conversations in previous meetings, and many of you are already aware of how it fits into CalAIM. But given all of the things that are happening in that space and some of the things that are starting to happen in that space for 2024, 2025, and 2026, we thought it was a good way to just kind of level set that foundational knowledge and really kind of talk a little bit about what's happening in San Diego. So a couple of quick updates. We'll hand things over to Lynn. And then after that, we have a small activity, if we have time, to kind of talk through some of our PDSAs. Those are our tests of change. And so how does the work that we're doing and some of the things that we do when we break out in these monthly meetings, how does that then translate into a work product? And so we'll talk a little bit about that in more detail, and then we'll close today with a few sort of next steps, announcements, what's happening in December as far as meetings go. So without further ado, I'm just going to keep this on the page for a quick minute. This will be available after today's session as well. But we are still hearing from folks that there's issues with the meeting invite. So hopefully we'll have this all straightened away and behind us, knock on wood, for 2024. But just a reminder, we've moved from those Google meeting invites where folks were getting inundated with those reminder emails every time we made a change or added somebody to our monthly meetings. We've moved from that to Zoom. It does require you to register. You only should need to register once, but select all of the meetings for the year. So there's just one more meeting between now and the end of the year, and that's December 18th. So that should be on your calendar. If it's not, you can re-register. But after you register, you need to select add to your calendar. If you don't, it won't make it to your calendar. And even though we have you registered as attending, you won't have that reminder once sort of fast forward your busy schedule. You'll see that that meeting isn't there. Second thing to kind of point out, those old meeting series should be removed. Everybody uses different calendars. And so for some of you, Microsoft Teams folks, there may be issues getting rid of that old meeting invite. And so you can go ahead and delete that old invite from your calendar, and we'll start fresh in the new year. So be on the lookout. Sometime in the next month, we'll be pushing through the series for 2024. If you're just joining us, please enter your name and your organization's name in the chat for roll call. Next sort of reminder is Slack. So Jack Daly, I don't know if you're on the line today, but thanks to Jack who put together a great Slack guide. We have that available to you all. It's here in today's deck, but we'll also share it with you in our follow-up email. But it goes over sort of best practices for using Slack. How do you get those email reminders? What channels do you want to subscribe to or not subscribe to? How do you kind of tune that noise and dial into the things that you want to dial into? So we're trying to kind of lean into Slack in hopes that we're not sort of inundating you with a bunch of emails and making it kind of difficult to sift through the things that might be important or might not be important. We've got a few channels now, so Slack channels. So if you've joined Slack, you can communicate to the rest of the CPI partners one-on-one by sending them a Slack message. But we also have channels to keep us organized. So I'm just calling everyone's attention to the news feed and events. We typically use this channel to push out different meetings that are happening in the community. If any of you have webinars, different community meetings, etc., please feel free to use this. We don't have to be the ones that are posting content in Slack. The intent is for us to be able to share and be as transparent as possible with different things that are happening in the community. So feel free to go ahead and use these as well. Next slide, please. All right, without further ado, we'll start with an icebreaker today before we get into our presentation. I'm sure this is making its way to all of your icebreakers in your meetings this week. But favorite Thanksgiving dish. If you don't celebrate Thanksgiving, you can definitely tell us what's something you're looking forward to, maybe in that time off. If you want, you can come off of mute, raise your hand, or put something in the Slack. So nothing super advanced here as far as technical representation. But favorite Thanksgiving dish, I'll share. Mine is artichoke hearts casserole. My grandmother makes it every year. We're taking on some of that responsibility. So I am going to try to make it this year. So fingers crossed, I don't burn down the house. Sweet potatoes, that's always a good one. Strawberry rhubarb pie. Ooh, yeah, stuffing. And everybody has a different take on stuffing. So we have a general Slack channel. So for those of you who are the chefs in your house, feel free, if you've got some recipes that you want to share, Emily threw on here bonus points for sharing your recipe in Slack. So I think she's put something through in the general Slack channel. But if you've got some recipes and you want to share, we can certainly use Slack to kind of share some of those things as well. All right, green beans casserole. I never could do green beans casserole well. I always, for whatever reason, mess that up. Pecan pie. Oh, Julie, that's a good one. Yeah, cranberry sauce too, Kristen. My grandmother makes an amazing cranberry sauce, and that orange zest, that's the ticket, I think. If you don't do the orange zest,
yep,
forget it. It just doesn't taste the same.
Agreed. Yeah. Also, the pecan pie has bourbon in it.
Oh, so that's the way to do it. You can't do it really any other way. Yeah, we always do pumpkin and apple for Thanksgiving. And if I'm lucky, I get a homemade blueberry pie because it's my all-time favorite. But it's a toss-up whether I see it for Thanksgiving or for my birthday month. So hopefully I have a blueberry pie coming in my future. Okay, why are we here? What are we doing? CalAIM Academy, or CalAIM Academy, geez, CalAIM. Really quick, if you're looking for everything or something CalAIM resources, there's been some changes on DHCS's website. We still call what we do in this collaborative CalAIM, but some resources in and around the state have now gone back to Medi-Cal transformation. So some of the pages and some of the links that we use in our reference materials, just calling that out because you may not see it sort of nested under a CalAIM page, but it's still very much CalAIM. It's what we do to think through and transform and strengthen Medi-Cal in the state of California, Medicaid for the rest of the nation, but Medi-Cal in the state of California. CalAIM is really a multiple initiative approach to really impacting Medi-Cal across the state. So thinking about that in a number of different ways. One way is through this PATH CPI collaborative. There are other ways that we look at advancing Medi-Cal. Some of it is through grant funding, both through the state and through something called IPP. And there are other aspects, and Lynn is going to talk about that in more detail shortly, and that is justice involved. And I think without further ado, Lynn, I'm passing it probably to you next. Wonderful.
Perfect. Okay. Thank you so much. This is great timing. So I appreciate the invitation to talk about the Justice Involved Initiative. And some of you on the call today are probably experts, and this might be some people's first time of even really hearing about the JI Initiative. I like to make it more of a discussion. So if there are questions, please feel, I'm not great at navigating chat while talking. So, Denise, if you see questions come up, please feel free to jump in, or if others have questions, because it's really complex and there's different components in the JI Initiative. But the reason I say it's ideal timing is because one of the components goes live in January. And so we're all kind of gearing up for that to go live. So if you want to go ahead, I'm going to introduce myself and then we'll jump right in. But I'm Lynn Carr. I'm Chief of Agency Operations here with the County of San Diego with our Department of Medical Care Services. And I'm with our SDAIM team, which is San Diego Advancing and Innovating Medi-Cal. So really our team that's supporting implementation. So I'm going to start with just, many of you are familiar with kind of this data framing San Diego, but most of us know that we have over 1 million people on Medi-Cal here in San Diego. That's about 1 out of 3 San Diegans. And we're the fifth largest county in the United States and the second largest county in California. And so some statistics you might not know, though, is what our local justice impacted population looks like. So in 2022, we had 37,142 adults and 562 youth that re-entered our local community from San Diego County jails and youth detention facilities. And so when we're talking about the CalAIM JI Initiative, what does this mean? What is the scope? What is the impact? And so there is so much opportunity that we're excited for with CalAIM for our justice impacted population. We're estimating, and this is a very general estimate, we're still working on kind of dialing this in, but we're estimating there's about 30,000 people. So 30,000 justice impacted individuals are likely to be eligible for services through CalAIM starting in 2024. This was based on just kind of a general estimate we did. We know about 80% according to the state are likely to be eligible for CalAIM services. And this does not even include our population that's returning from our state prison. So it might be even a little bit higher, but we're going to dial into that estimate and we'll share it when we have it. So we're thinking about 30,000 people will be eligible. So we wanted to go to the next slide. And I think Denise did a good job. I was also going to mention in this slide that we're hearing CalAIM now be referred to as Medi-Cal transformation. So, what is really the center of this? And it's really, it's person-centered care. It's really ensuring that we're addressing both those health and social needs. And so when we're talking about I'll give a case example from a justice impacted person of what CalAIM looks like, but really getting down to, addressing equity to support equal access to health and well-being. That's what we really want to ensure, that people have access to the services that they need. So we want to go to the next slide here. Today, we're going to focus on the JI initiative, but we all know there's many different components to CalAIM. This group tends to really focus on ECM and community supports, which is actually part of also the JI initiative. So if we want to go to the next slide, I'll kind of jump right in. So I share this, for those of you that have heard me talk about the JI initiative, you've seen this slide before. This is a slide that I borrowed from the Department of Healthcare Services, and they share it usually at all of their presentations they do on the JI initiative. The way that the state has developed the CalAIM JI initiative is there's different components, and then they show it like a puzzle, that each of the different components are supposed to fit nicely together. The first three pieces of the CalAIM JI initiative of the puzzle are services that happen within that carceral setting. And then the last three are those that are really supposed to happen in the community. Actually, the ECM component will happen kind of both in the setting and then in the community, and I'll talk about that later. But the first component is, and I'll get into more detail, is the pre-release Medi-Cal application process. The next component is 90-day pre-release services. That goes hand in hand with the next, which is behavioral health linkages, and then enhanced care management in the community, along with community supports. And then the last piece is really supporting that transition. So if you go to the next slide. So I want to share some background for those that don't know. This is, it's groundbreaking. Actually, the CalAIM JI initiative is groundbreaking. So about a year ago, on January 26th, California became the first state in the nation to receive federal approval to offer a targeted set of Medicaid services to Medi-Cal eligible youth and adults in state prisons, county jails, and youth correctional facilities for up to 90 days prior to release. Why is this such a big deal? This is such a big deal because across the entire United States, when someone goes into a carceral setting, their Medicaid, or locally Medi-Cal, is either suspended or terminated. So this is something that we've never done before. So California is creating this blueprint or roadmap to how we can offer a set of Medi-Cal services while someone's in custody. And so that really the goal here is continuity of care and getting people access to services that we do have local services. So I don't want to paint the picture that people aren't getting really good services now, but through the opportunity here is to expand the scope and services that people are eligible for. So the key components are ensuring people have active Medi-Cal upon release, access to pre-release services, and then post-release care coordination. And really that post-release care coordination is through enhanced care management, which is through ECM providers who are contracted with our local Medi-Cal managed care plans. So if we want to, next slide, please. So here is just, I mentioned a case example. I like to kind of paint the picture of what this actually looks like. So we'll tell the story of Cameron. So Cameron's currently incarcerated in a San Diego County jail. He's uninsured, so he's going into jail without any insurance. He's unstably housed, so he was couch surfing before he went into jail. He's been diagnosed with bipolar. And so when he returns to the community, he's going to need to see a psychiatrist. So he might be seeing a psychiatrist in jail, but he won't, typically he'll need that handoff to someone when he returns to the community. He'll also need assistance with finding secure housing, and he'll need health insurance. So under the CalAIM JI initiative, Cameron will be able to enroll in Medi-Cal prior to release. Due to his mental health condition, he qualifies for 90-day pre-release services, and he'll be assigned a pre-release care manager who will conduct a needs assessment and develop a reentry care plan to support his transition. He'll be connected to a psychiatrist in the community who will continue to care for him, and that's through the behavioral health linkages. He will also receive a 30-day supply of his medication to take with him upon release. Once in the community, he'll be able to receive enhanced care management services. His ECM lead care manager will connect him to health and social services in the community, including community supports, which includes housing navigation to help him find a housing solution and help him build stability in the community. So that's really, if everything works as designed, that's how the CalAIM, the different benefits and supports can assist someone who's in our current local jail re-entering our community. So we can go to the next slide. So this is the timeline. I think this is really important to understand. The state has actually shifted some of the components recently. So I wanted to share what the current timeline. All the different components under the JI initiative are actually going live at different times. So this is a really helpful slide to refer to. The first component is enrolling people in Medi-Cal, and that actually started January 1st, 2023. So I've had people ask me, when does the CalAIM JI initiative go live? It actually went live almost a year ago. We're working hard on enhancing processes to ensure that anyone that enters our local jails and youth detention facilities have the opportunity to enroll in Medi-Cal. Also, the State Department of CDCR, the Correctional Department and Rehabilitation, they are also mandated to ensure that people are enrolled in Medi-Cal prior to release. So the next component, which is we're building up for, we're really excited for, a month and a half away, January 1st, 2024, enhanced care management for the JI population will go live. And then the next is behavioral health linkages, which is set to go live October 1st, 2024. And then last but definitely not least, 90-day pre-release services. That can go live no sooner than October 1st, 2024, and no later than September 30th, 2026. There's actually a 2-year implementation period. This is a huge undertaking, and all the every region, so the CDCR at the state level that oversees the prisons, they will have to demonstrate readiness 6 months prior to going live. Are the counties, each county that operates their jail system, they will have to demonstrate that they have the ability to go live 6 months prior, as well as all the youth detention facilities. So one county might go live, for our managed care plans that are on the line, say LA County, they might go live in with their local jails October 1st, but you might have another county that doesn't go live until, say, mid-2025. So you'll see different jurisdictions are going to go live with this at different times. They do have to demonstrate, there's a readiness assessment due 6 months prior to going live, and the state has to give approval that the jurisdiction is operationally ready to go live. Locally, we're I don't want to speak on behalf of our Sheriff's Department or Probation Department, but we're probably looking at sometime in 2025 going live with the 90-day pre-release services. So next slide. And I'm not seeing any questions. I don't see any hands, but Denise, do let me know if any questions are coming up, or if anyone has any questions.
We did have one question come through from Brian, and I'll just read it out. The question is, the data is clear that justice-involved individuals re-entering the community are more susceptible to overdose than others. That said, do we have any reliable MAT, Medi-Cal referral partners with the same day admission capabilities?
Okay, let's table that question to the end. That's because that's a really great question, but it's really very operational. But that is, I do want to call out that MAT, medication assisted treatment, is actually part of the 90-day pre-release services. And so that was something that we're, designing that right. Someone would be getting services while they're in our local jail setting. And then there is language in the policy guide about ensuring, that someone gets connected to services like same day or as close to possible upon release. That is a really important piece of the JI initiative. So thanks for calling that out. So kind of in any question like that, you can ask it now, or we can table it to the end, because those are some great questions, and some I'll just need to get back to. I might need to consult with our Sheriff's Department or Probation Department if they're not on the line today. So going into the pre-release Medi-Cal enrollment process, I can go through this pretty quick. it's a requirement that all state prisons, local jails, and youth detention facilities have a Medi-Cal enrollment and suspension process. We have one locally where we're really fortunate. Basically, someone comes in, they're screened, do you have Medi-Cal? If not, they're given the opportunity to enroll. So that is currently in place. We are working on enhancing it and doing some more automation for that process. So next slide. And then, so now that's the first, when we talked about the components, right? That is the first piece of the puzzle. I'm going to jump in. I'm going to do this kind of chronologically to go along with the timeline. The next component is enhanced care management, and that goes live in January. So I think everyone probably here knows what ECM is, but just to recap, it's really that care management, care coordination benefit. If you know, and we know if someone has to have Medi-Cal and be assigned a managed care plan to and then fit one of the and we'll talk about the populations of focus. But what that is it's really to ensure, right, that smooth linkages to services and help people arrange appointments to healthcare, different social services, do that assessment to ensure if they qualify for a community support, that they're linked to a community support, and as assign that lead care manager that's really navigating that for them. So next slide. So here is the populations of focus, and really quick on this slide, if you see at the very bottom, it's bolded, the individuals transitioning from incarceration. That's the population of focus we're talking about right now, and that goes live in January. Many of our justice impacted individuals probably fit into a current population of focus that is live. So many of our ECM providers might be serving our JI population right now. Individuals experiencing homelessness, our SMI, SUD population at risk for avoidable hospitalization. So there are, many people fit into different categories, our most vulnerable populations. So this is not necessarily a new population for some of you, but it broadens who's eligible, right? And it can go into more details on who fits under that criteria. So if you want to go to the next slide. So this is who's eligible for ECM under the JI population of focus. For adults, it is adults transitioning from incarceration. And incarceration is defined as someone who's in our state in our state prisons under CDCR, and then our local jails, our county jails, and then our youth detention facilities who are locally, it's overseen by our probation department. And so that is, it has adults transitioning from incarceration. The adults have some extra eligibility criteria. So the first is have to have Medi-Cal and a managed care plan. Second is being transitioning from incarceration or transitioned within the last 12 months. And then must meet one of these criteria: mental illness, substance use disorder, chronic conditions, intellectual or developmental disability, TBI, or traumatic brain injury, HIV/AIDS, or pregnant or postpartum. And then the distinction on the youth who are transitioning from our youth facilities, the only eligibility criteria for them is have to have Medi-Cal and managed care plan, and then must be transitioning from a facility. They don't have to meet one of those criteria as listed for the adults. So that's who's eligible for ECM. Now, this is some of the requirements. This is also a slide borrowed from the Department of Healthcare Services. For JI ECM services, the managed care plans, they're responsible for ensuring timely access to ECM services and that the range of care plans executed. So the state is really emphasizing, and I think that question that came up below about medication-assisted treatment and ensuring timely access to care, that this is one of the reasons why it's so important that individuals get linked to ECM so quickly. There's data that supports overdoses, homelessness, the likelihood of going back into jail. If someone is not connected to services within that 72 hours, ideally 24 hours, but 24 to 72 hours, the risk grows so much greater of overdosing and other negative consequences. So it is really important, and really just, you can lose people, right? They leave, and then, whether you have a phone number or an accurate address, it's much harder to connect if you're not doing it, really as quickly as upon release. So the managed care plans must ensure that ECM services become available the day of release or as close to the day of release as possible, and ensure that ECM providers meet the JI individual within 1 to 2 days of release. And then there's also, and then again within 1 week of release. So ideally, you know, the same day or next day, and then another visit within a week. So that is what the state is expressing as how we want to ensure that people are connected to services as quickly as possible. So we want to go to the next slide. So here, I think this is a really great slide. I know it's a little bit small. This is also a slide that's borrowed from the Department of Healthcare Services. For those of you that are in ECM providers or interested in becoming ECM providers that also want to serve the JI population, there are some, there's just some small distinctions between what is required for a JI ECM provider versus some of the other populations of focus. So one of the big ones is that for the JI ECM providers, they need to enroll in the PAVE system, the Provider Application and Validation for Enrollment System. The reason for this is a little complex, but I'll try to simplify it as best as I can. The way that the state is designing ECM is we're talking right now about how it's going to work January 1st, 2024, and that's that someone would be connected as soon as release as possible. However, when 90-day pre-release services goes live, the JI ECM providers will be required to do InReach, whether that's virtually or in person, while someone is still incarcerated. And that's really best practices, the InReach, because you're building the rapport and doing a warm handoff with the pre-release care manager. And so in order for ECM providers to be able to bill for the InReach component, they need to bill fee for service. So they have to enroll in PAVE. So, you know, this might be, Denise, maybe this is like a 102 where we come back and, you know, as this gets closer to 90-day pre-release services, because we'll have to talk about what that looks like. But it's really important for ECM JI providers to understand that they will need to be able to bill fee for service and do InReach. And then, you know, there'll be, once someone returns to the community, then it's through your typical ECM through the managed care plans. So that's how the state has designed that the JI ECM component will work both in custody and in the community. A best practice is having experience serving this population of focus. The state is really not requiring, but really encouraging the JI ECM providers to have staff with lived experience and really understand the complexity of the JI population and have experience serving the JI population. Those are the main kind of, oh, another one I want to actually call out is the state is also strongly encouraging network overlap. So the state is encouraging that the JI ECM providers actually contract with all local managed care plans so that there's overlap. And the reason for this is, I'm kind of getting into the weeds a bit too, but it's important to understand this. When someone's in a local jail or a prison or a youth detention facility, if they don't go in with Medi-Cal and they're being enrolled in Medi-Cal, they're going to be auto-assigned into a managed care plan. So you might not know who that managed care plan is until really close to release. And if you're working on that reentry plan and you're trying to connect someone to ECM in the community, if all of the ECM providers are contracted with all of the local managed care plans, then it shouldn't, there will be continuity of care. It will, if someone's in jail, I'll give an example. We'll talk about Cameron. If Cameron, who I talked about earlier, say we don't know who his managed care plan is, then the jail staff can actually do a referral or connect someone to any of the local ECM providers, JI ECM providers, because it won't matter what managed care plan Cameron's auto-assigned to. We know that organization A is actually contracted with all of them. So that say, if, you know, otherwise, if Cameron gets referred to organization A and then gets assigned to a plan that isn't contracted with organization A, then they would need to like reassign him to a different ECM. So I hope I'm making that it's kind of clear as mud, I feel like, but I'm hope I'm making that clear that it will be really important that we work together as a community to ensure there is that overlap. And if there's a reason that a CBO is having a hard time contracting with one of the plans, we want to work through it. We want to work through any barriers, because it's really important for this to work, that it's as seamless as possible. So if we want to go, if there's no questions on that, let's go ahead to the next slide. Okay, so this is, and Denise, if I need to hurry up, I know I'm trying to get through this as quick as possible, but please do let me know if I need to kind of move quicker. This is how we envision this working. This is definitely a draft flow chart, but this is how this is envisioned to work. So a youth and adult correctional facilities will enroll eligible individuals into Medi-Cal prior to release. That's the first step. You can't get access if you don't have Medi-Cal. The next step is individuals who do not have an assigned Medi-Cal managed care plan prior to incarceration will be auto-assigned into an MCP at time of release. I've gotten questions on this. There is an algorithm the state uses. So if someone has been assigned to an MCP before, they're potentially going to be assigned to that same one, or if there's family members. So there is an algorithm the state uses to auto-assign. And then the next is the managed care plans. One of the requirements is that the managed care plans will need to update their provider directories to identify the JI/ECM providers. So it will say in the directories who are specifically the JI providers. And then eligible individuals will be connected to a JI/ECM provider upon release. The JI/ECM providers are then encouraged to meet with individuals as close to release as possible. And then the JI/ECM providers will continue to provide care management in the community and connect individuals to health and social care. And especially this is ensuring they're connected to available community supports. So if you want to go to the next slide, I put up the community supports. I don't think we need to spend too much time on this, because this group is familiar, but we know that we have, I want to say it's 25 to 30%, the last statistic I had heard of individuals that are going into our local jails that are have housing instability. So really, that's something that our JI/ECM providers should be assessing for, right? Is housing needs. And then all really medically tailored meals. Really, all of these services could potentially be applicable to some of our individuals we're serving. So just making sure that we're assessing for all of the needs. Next slide. And then changing gears a little bit. So we talked about the first two components of the CalEMJ initiative, Medi-Cal enrollment, and then the next, JI/ECM. Then the next one to go live October 2024 is behavioral health linkages. And so what this component for JI is that individuals who have a behavioral health need that are in a carceral setting, so substance use, mental health need, they will be assessed and identified. And then there's a requirement that there must be a behavioral health linkages as they return to the community. So we talked about Cameron. Cameron had bipolar. He needed a psychiatrist. Under CalAIM, there would be that appointment for the psychiatrist prior to him returning to the community. Now, there's different levels of need, right? And so some are through, say, the county behavioral health services. Others that behavioral health services need might actually go through the managed care plan. So there is a requirement for bidirectional data sharing between the managed care plans, behavioral health services, and our local sheriff's department, probation department. So we'll need to build pathways to make sure that we're sharing that data for smooth transitions and linkages. So last but not least is the 90-day pre-release services component. So this is the exciting groundbreaking initiative. So 90 days before someone's released, right? We've assessed them for Medi-Cal. We've assisted enrolling in Medi-Cal. There's a screening that will happen while someone's in custody. And if they meet the eligibility criteria, which is the same as the ECM criteria, if they meet that eligibility criteria, then they will be eligible and should receive this set of list of services. So reentry case management services, so they'll be assigned a pre-release care manager, physical and behavioral health consultation, laboratory and radiology services, medications and medication administration, medication assisted treatment. We talked about that, MAT, and then services provided by community health workers with lived experience. I mentioned before with Cameron, this is a big one too, is that right now there are individuals are receiving some medications as they're leaving jail, but there's never been this requirement for 30-day supply of medications. So this is huge. And so under the CalAIM-J initiative, individuals will either leave with the medications in hand, or we're still working this out, a prescription for the medications, a 30-day supply, and then any durable medical equipment that they need upon release. So next slide. So this is just getting into a little bit more of what this pre-release care manager looks like under the 90-day pre-release services. The pre-release care manager, there's two different models here. So the way, and I refer anyone that has additional questions, there's actually a CalAIM-JI policy and operations guide, and it was updated and released October 20th, and I can send that out. Or I can send it to you, Denise, and maybe you can distribute, but we can get that out. It's about 200 pages long, and it provides the details on all of the components. But the way that the 90-day pre-release care manager, there's two different ways that this can happen. So the pre-release care manager can be an embedded care management provider. So it actually can be like a correctional facility staff, or the facilities can contract with a provider to provide this. Or it can be the community-based care management provider who's also the post-release ECM provider. So locally, that's something that we have to determine. The correctional facilities will have to determine. So CDCR will have to determine their model. Our local sheriff's department will have to determine their model for the jails. And then our probation department will have to determine their models for the youth correctional facilities. So they will either hire staff or have staff acting as these these pre-release care managers. They'll bring in a contractor, or they'll create a system where it would be the post-release ECM provider that would be billing under fee-for-service. So that is yet to come, and we can come back later as we're getting closer and present the model. But really what that pre-release care manager is doing is they're completing a whole person needs assessment. They're doing care linkages and coordination with CBOs. So if someone is identified as needing housing, they're working to try to find a housing solution. If they need to apply for benefits, if they if they're involved in our child welfare or child family and well-being, they're connecting to services there. So whatever those needs are, it's really looking at the whole person, assessing needs. They're providing the warrant handoff between the pre-release care manager and the ECM provider if it's different, and then completion of a reentry care plan. And I want to highlight this one. There's a reentry care plan that is required to be completed. It's from what I've seen, it's very comprehensive in how it's described in the policy guide. And that information is required to be shared with the Department of Healthcare Services, the managed care plans, and community providers. So that's something that's new that we're going to have to build some systems to be able to share this plan. So a lot of things that need to be built between now and our go live date. So next slide. So that's a really quick overcap of the different components of the JI initiative under CalAIM. And it's, I'm going to use this. I know people kind of get tired of hearing it, but we really are building the plane. It might not even be that, because there's already planes, so it's something, it's like the futuristic plane we're building, because there isn't currently like a roadmap, or there's no really anything we can look at, because we are the first state that's doing this. So I've said before, we can't phone a friend and say, how are you doing this? It's all brand new. So it's exciting, and there's a lot of opportunity. So if anyone has any questions, and if there's time, I'm happy to try and field those.
Thank you so much, Lynn. I appreciate you coming and presenting today. I think it is everything that you described. It's complex. There's a series of different unique work groups, and there are different workflows associated with this. So it's important to understand a little bit more about how the pieces and parts fit together. And I think the other thing too is the timeline. Just because the 90-day pre-release has been pushed out a little bit further in time doesn't mean that there's nothing happening between now and that time. And so I think that that's a critical piece to pay attention to as well, which is the population of focus and the ECM eligibility that's going to be new for 2024 in January. So thank you again for that. I see, Robert, you have your hand up. We'll have some time for questions. If you want to also enter your questions in the chat, that will be really helpful. And then next, we'll go through an overview of the PDSAs in play. So what are we working on, and how have we been working on it? Go ahead, Robert.
Thank you, Denise. Real quick question, Lynn. And actually it's more of a statement than a question. So 2 years ago, I was actually working on the Cal ID 717 Assembly Bill, and it appears that CDCR is still struggling with implementing that, and that's going to be a very important component for the ECMs and the 90-day pre-release, that individuals relieving custody have that ID. Because without that ID, it's going to interfere with even just as something as simple as getting their prescription. So we need to kind of like maybe push them a little further in regards to ensuring that they already had that implementation done, and they've had enough time to get it done. So, and then there is a benefit with the 90-day pre-release being pushed forward for 12 months. And that should give the other agencies more time to actually get all that lined up. But that ID component is going to be vital.
Thanks. Yeah, thanks for bringing that up. We are working with CDCR and trying to pull them in, collaborate and pull them into more of our local work groups. And they've been very responsive. So that is something locally, our sheriff's department is really, leading the way on those IDs and some legislation. So I think we could probably offer some lessons learned to CDCR. So thanks for raising that.
And then I just want to call everybody's attention to a note in the chat. Cami, I don't know if you want to talk to, or Lynn, maybe if you want to talk to some other changes sort of in San Diego around infrastructure. So we're really lucky, I think, in San Diego in a number of different ways, and it's not necessarily the same across the state. So just acknowledging that. And then maybe, Cami, you could talk a little bit about what these jail release alerts are and why they're so critical as we talk about care transitions.
Sure. And Lynn, I'm sure you have additional context, but for those of you who are familiar with CIE, there's an alert functionality. So you can get an alert if somebody is booked into a jail. You can get an alert as a care team member if a client or a patient's status changes. And we've been working for a very long time working with public safety, and we have a data sharing agreement signed, and we're still working out the details of what it looks like. But what it will allow us to do is to ingest information in CIE that includes the release date. So the booking information, while it's helpful, the expected release date is a game changer for being able to coordinate care. And there's some intricacies around, as Lynn talked about, the time frame and all of those things. And so we're working out those details, but we do have all of the bureaucracy of signed agreements done. And we're talking about the technologies, and the technologies, all of that work has been done. And so what that will allow us as a community of care coordinators to receive an alert when there is an expected release. Oftentimes, there's a release at a court date unexpected and other things. So it's not solidified that this is like the one true source of information. It's just another tool and an expansion of our existing CIE that may be impactful for this population.
Thank you so much, Cami, for that. And I don't know about you guys, but this is to me, this is really cool. Because it's a way for us to think differently about how we can prevent somebody from falling through the cracks, right? And so these event notifications just in general have a huge value, and there's a lot of data across the nation about what a critical event notification does and the impact that it has on on care. And so to think about this as being a critical event, and really, you know, a way for us to notify care providers of this event so that we can make sure that we're aligning the resources to really set someone up for success, is really amazing. And so, and I can attest that there's a lot of work and paperwork just to make something like this happen. And so really excited to see what that looks like for 2024. I think that it's going to be a game changer in San Diego. Cool. Okay. Any other questions before we? Oh, let's see. Oh, Nancy, this is a good question. Do we ever do cross-county collaborations? I don't know. Do we get? I'm not Cammie. I don't want to put you on the spot, but is this something that we would consider? Maybe looking at neighboring counties.
For IDs, it looks like I'm looking at the note in the chat.
I can, you want me to jump in, Cammie, on this
Yeah, go
one?
ahead, Lynn.
Okay, and feel free to jump in too. But you know, we actually, San Diego, I would say on this one, we do collaborations. There's different meetings that are held kind of at the state level. There's, you know, the sheriff's department has like a sheriff association that they pull together and work with other counties. Same as probation, same as our local health department. So we do actually do that learning from other counties. But San Diego's leading the way with IDs. And so our local sheriff's department, I'm like, I don't want to speak for them, but I don't think they're on, but they actually, they're mentioned in some new legislation. So they figured out, and for those of you that are familiar with our local reentry roundtable, some years ago, this was raised through our local, that was kind of where it started. Yeah, see, I see Robert, thumbs up, is that this was identified as a need, and the sheriff's department was responsive, and they worked with the DMV to figure out how to do this. So they actually have a really great process for getting people IDs prior to release. And so we've led the way, and our sheriff's department led some legislation to make it happen. So I'd say that other counties are looking to us actually on this area of IDs. But I'm going to read your comment, Nancy, more thoroughly, but I think we could probably share with CDCR how we're making it happen. And I know there's always room for improvement. So
Thanks, Lynn. I am going to keep us moving forward. If anybody has any questions, please definitely, you can reach out to us. We can get the information over to Lynn. Lynn's got her information, contact information here as well. And feel free to enter those questions in the chat. We'll save that and make sure that we address all the questions that are not yet answered during the meeting. So if we don't get to it today, please definitely still answer it in the chat, and we'll follow up. Okay, so let's talk a little bit about some of the things that we are doing. We talked in, gosh, it seems like a lifetime ago, but it was just last month in our October meeting about our PDSAs, so plan, do, study, and act, which sort of nests under QI methodology, quality improvement methodology. And so if you want to go to the next slide for me, Ryan, under that, we have a couple of things that we have in play. And so while it may not always feel like it, we are kind of putting some of the work that we're doing in our monthly meetings and in different coffee chats and building them out into this sort of structure. And so I'll talk a little bit about that in two different ways today. And we'll talk about an update on that best practice playbook. So for those of you that attended our in-person in September, we took information during that meeting and did something called a parent share. Basically, we made decisions as a group on some things that we thought were really great best practices. We want to document them, and then we want to build ways that we can together as a community and as a collaboration, implement those best practices and share those best practices in our community. We're also doing other work specific to data. So last month, the data standardization work group shared out some of the things that are happening there. We'll continue to bring that back to this group. And we have the managed care plans sharing with us quarterly reports. And so we'll have Q3 hopefully shortly, and we'll be able to share that with the collaborative. And then as the aggregate continues to get reviewed by the data standardization work group, we'll be able to kind of have them look at and analyze the data in a more granular way, maybe by populations of focus or community support service, and bring some of their findings back to this group as well. We're also talking with that group and probably other forums as well, given the data exchange framework in the state of California, about what does data sharing mean and what does that look like in San Diego? We have infrastructure in San Diego and data is being shared, but how? What data is essential when we talk about different workflows or where there are gaps or where there are roadblocks in some of the exchanges? Whether it's a referral or trying to identify a person or trying to identify what managed care plan a person has. So just kind of thinking through some of these pressure points and how we might be able to kind of come together by stakeholder or by category to say, this is the data that makes sense to be shared. And here's sort of what we think about, at minimum would be ideal if we could share across that stakeholder category. Last but not least is CalAIM Academy. So it's not sort of your traditional PDSA, but it is something that we've been kind of pushing through that PDSA process. So we'll talk a little bit about that today as well. We'll break out, if time allows, to get some feedback from you all as we're getting closer to closing the books in 2023 and planning for 2024. What does that look like? Do we want to still do it? Does it have value? Where is the value? What's missing? What should we be pushing on or leaning into? What content are we not providing or sharing that might make sense for us to add under that CalAIM Academy umbrella? Next slide for me, please. So without further ado, we'll give you an update on where we are with PDSA #1, which is our best practice playbook. September, we started the conversations. We started to get some initial decisions made on those best practices. And the team here at Intrepid has been actively working on outreach, interviews, data collection. So thanks to Ryan, who's really kind of made this take shape. So when we talk about like, how do we take a design or a concept or a conversation that we have and make it something tangible? Really, really, really excited for this. I think it's going to have value over the next couple of months and on into 2024 and hopefully far beyond. So that sort of started in October and we continued that through November, really kind of putting that information in to a document and having it sort of structured. And then by the end of this month is what we're pushing for, where I think we're going to get it. We'll have a first version of that best practice playbook to share. And so we're trying to think, what does that look like? So last month when we met in October, we tried to take under that best practice playbook and get some folks to think through different tests of change that would sort of help sort of the best practices that had been decided and maybe add new best practices to that playbook. We know you guys are busy. You're in 90 million other meetings. You're doing all of this other work outside of these monthly meetings. And so while we asked you all to sign up and report back, we know that everybody is super engaged and committed. And I don't think that that's not the case, it's still really hard to ask you all to do a whole bunch of work outside of these meetings. So recognizing we had a great conversation on the 27th, but not so much a lot of traction thereafter. We're going to kind of take a different approach for our test attempt number 2. And so what we're looking for is a few folks who are interested in a really small focus group. Can we get you to come together, look at the best practice playbook, give us some more granular feedback, more constructive feedback, and then we'll use that as a way to sort of solidify that first version of that best practice playbook and share it with the entire collaborative. And then I want to go one more slide. This is sort of the initial table of context for that best practice playbook. And Ryan, what did you call it earlier today? Joyfully scrappy? Joyfully
Yes,
scrappy.
joyfully scrappy.
It's absolutely joyfully scrappy, but I would say it would be even more scrappy if it was my hands putting this together. So Ryan's really done a great job of 2 things. One, bringing that information in that was initially discussed and decided from December's meeting, but he also went out across the state and located some best practices that are already being recorded. And he's added that information into this best practice playbook. So we'll have some of our local insight and we'll continue to kind of collect that as we move forward over the next months and far beyond. But in addition to that, we're trying to kind of keep together in a central place other best practices that are being shared and publicized across the state. So I think that's another benefit to this best practice playbook. It's something that we've talked about before. What are other people doing? How are they approaching different things that are happening in the community? So the more we can pull from that, we'll continue to add that into this document as well. Before I stop and kind of go into the next activity, Ryan, I just wanted to give you a chance. Is there anything that I missed or inaccurately represented here with the best practice playbook?
No, I would just say thank you to those who have helped with providing some of the information that we have so far. And it's going to be a living document. So like Denise said, it might not look super fancy at the beginning, but I think what we really want to make sure that we're capturing the right content and we're presenting it in a way that's helpful for you and your teams. And so, based on what the feedback that we get from the first version, we will add and change and adjust. And so this, will continue to evolve with the idea that as we have these best practices shared, other organizations are maybe trying to implement some of those and refining those best practices so that then we can say this is a best practice because it's been tested in various settings. So so thank you for your support on that.
Thank you so much, Ryan. So if anybody is interested in being part of that initial focus group and really kind of digging into this best practice playbook, please put your contact information in the chat. You can send it directly to us if you want by just selecting that feature to share with everyone versus sharing with the host, or you can just share that information with everyone. We really only need maybe 2 or 3 people to kind of help run a couple of things by and get some feedback on before pushing this out to the rest of the collaborative. So please let us know if you're interested in being part of that discussion. And if I don't see anybody volunteer themselves in the chat, I may volunteer on your behalf.
It won't be a significant time commitment, so we'll put that out there too.
I'm on board. So if you don't get anybody, the justice population is my family. So I'm here to serve.
Thank you, Robert.
And Denise, I could say that, you can reach out to someone with our SDM team because we want to support.
Awesome. Thank you so much.
I'll assist, Denise. This is Cami.
Great, awesome. Thank you, everybody. Heather, I see your note as well. Much appreciated. All right, well, we've got our group to push this forward to the next phase, and I'm really excited to keep this moving forward as well. So we have a little bit of time left today. We're gonna have an activity, a breakout activity. We're not gonna ask you guys to do a whole lot of work. We know it's the Friday before a holiday week in November. So we're gonna break out into 2 groups. We're not gonna have any Google Sheets or any requirements around a real heavy lift. But we want to get some feedback from you so that we can continue to scale and push our Calium Academy forward. And so how does this fit into, or how are we fitting it into the PDSA framework? So what did we do? We started working with the managed care plans who initially said, we're really interested in coming together and doing some training and education in a single outlet versus having all of our enhanced care management and community supports providers attend different trainings at each of our managed care plans. Cool. So we got that started and we talked a little bit about what does the first phase of that look like. And that was our first 3-part series, Calium Curious, which we did not invent. We did not coin the phrase. It's a good one. It's catchy. But full credit goes to, I think, Health Begins, who coined the phrase initially. But really, it's exactly what it says it is. It's a high-level overview. It's those who are curious, but maybe not well-informed on Calium. We talk about what it is and what it isn't. We talk about how to credential and contract with managed care plans. But we don't get into anything super granular. We also have those lunch and learns, which talk about authorization and referral processes by managed care plans, as well as the office hours where managed care plans answer questions for our PATH CPI participants. So we did our first version of that in July. We took information from participation and from surveys to kind of think through what is our second version or our second PDSA cycle look like. So we did that evaluation and we applied some of our lessons learned based on that data. And then we pushed through a second version of that. And we also added a few different sessions. And so we did those additional events, and then we kind of moved back into the completion of those events, the doing, and then the evaluating of those events. But now that's sort of been completed. And as we look out to 2024, what does that new iteration look like? And can we kind of think through a new cycle of maybe some additional events or additional measurements of these Calium Academy sessions? What does that even look like? So we're going to break out now for just maybe 10, 20 minutes max, and talk a little bit about the Calium Academy sessions. Most of you have participated in. If you want to go one more slide for me, please. This just kind of gives you a little bit of overview on number of people who have registered, number of people who attended, and the average attendance rating, which 52% is actually pretty good, all things considered, when we look at just in general webinars and registered versus attendees. So all of that to say, if you want to go one more slide for me, please. We're going to ask you all to do a few things, 2 stars and a wish. It's very similar to I like, I wish, I wonder. One more slide for me, please. Basically, we want to know what's working. Can you tell us what you liked about the series thus far? What should we keep and not scrap? And then where and what do you wish we could do better, differently? What topics, series, etc., that we could do differently as we start to plan for Calium Academy 2024. Okay, so that's what we're going to do. We've got about 20 minutes left. today. We're gonna break out. Maybe we'll do for 10 minutes and then we'll come back together, share out, and we'll talk about next steps and let everybody get out of here. All right, Shelby, take us away. So there's 2 rooms. And then Shelby, can I just do this for everybody? Can I just push everybody into a room?
Yes, it should be open.
Oh, here we go. Okay. Oh, I've got to do it just manually, yeah? Okay,
Oh, well.
that's okay.
Yeah, I thought I had put it automatically, but I can help with that.
I think I've got it. There's no way I can select multiple people at the same time, right? No, it's okay. All right, folks, you're just getting pushed into rooms. I'm just pushing you into different rooms. Can you tell where I am on the technology compared to compared to Shelby? All right, Ryan and Shelby, you want to go to room 2? And I'll go to room 1. I'm going to put you over there.
I thought I left. What the heck? You can't get rid of us, Denise.
Emily's off today, and I'm actually pushing more of the buttons than I normally do. So, you know, who knows what happened. I don't think that the other breakout rooms. Oh, they're gonna close in 17 seconds. Oh my heavens. I guess I can't do it all. I thought I could just hit a button. Welcome back, folks. I know it was a quick one. If you have other feedback that you didn't get to share, please let us know. And we'll talk a little bit about the let's see, here we go. Yeah, if you want it, that right here, Ryan, just leave us right here. Can folks see that screen? Yeah, okay, cool. All right, so different things that are happening in December. I know we got a couple of minutes left, but we do have a meeting on the 18th of December. So that's our last monthly meeting of the year. We're going to take some of the feedback that you've given us today around Calium Academy and see what we can do to incorporate that. We do have a couple of sessions coming up. So really trying to get the word out for not all of us that live this and do this every day. So we're trying to push out to other wraparound providers, folks who would be, yeah, let's see, how do I do that? Ryan, I think we've got a different view. I don't know if it's yours or mine. And we'll share it with folks. We can leave it actually. We're getting ready to close. But the moral of the story is we've got a few meetings coming up. There's other things that are happening in the community. Heather, Michael's already posted on your website. I know we're trying to get the word out for those events in December. We'll take feedback from you all from Calium Academy and incorporate that into the new year. And if we don't see you all in any of those meetings, we'll see you at the meeting on the 18th if you're around. And Julie, I see you have a question. You're on mute though. You're still on mute.
She's practicing sign language.
Okay, there we go. The 18th is a Monday, so it's not the usual day of the week because we're going into Christmas and stuff like that, right? You didn't put the wrong date or something else.
We did not put the wrong date. We were originally scheduled the week after on a Friday, and I would wager that nobody wanted to join us that following week, the Friday. So we did push it. We got rid of the coffee chat for December. We took the date and time of the coffee chat, which was originally the 18th, and said we'll repurpose that for our monthly meeting. Also, though, we recognize not everybody will be around. We do have another presenter for December. So Christy's going to be talking about the neighborhood network. Really, really cool. And so we're excited to kind of bring that to the group as well. So please join us for December. And we'll push through on our Slack channel the other meetings and events that are happening in the community and across the state as we hear about it. If you guys hear about events, please push them through that Slack channel. Let folks know what's going on. HealthNet did a really cool presentation this week, not last week, on sobering centers. And so it was a great presentation and we pushed that through the Slack channel. But if you guys know about things that are happening, please definitely add it to that Slack channel for the group to participate in. Lots going on. I hope you all have a wonderful, wonderful holiday. I hope you get to spend some time with family and friends and rest and relax because you all are busy. You all have 90 million things going on doing the work that you do for the community that you serve. So keep it up and have a great holiday. Bye, guys.
Well.